Well, health care is the top of many Utahns' minds, and it's definitely the top of those in Washington. It was even President Obama's birthday wish.
And this morning, we have Utah Democratic Congressman Jim Matheson in to talk about what's being done. And hi, Mary.
Hi, guys. Well, we have Congressman Matheson here to mostly talk about health care. I guess with the big health care reform plan and everybody, it's such a huge issue right now. Why is it so hard to solve what needs to be done?
Well, first of all, it's a really complicated issue. It really is, and it touches everyone in America, so we got to make sure we get it right. The issue that I think people need to think about is that even if you like what you've got right now, we got to build stability into the future, because we all know our costs keep going up. If you're a business owner and you pay for your health insurance for your employees, you see those costs going up way over inflation every year. We see our co-pays going up, our deductibles going up, our individual premiums going up. So I think the reason we need reform is we got to try to have our system get more in line with inflation, or we're going to lose what a lot of us like right now.
Okay, so how can you balance it out?
You know, you've got to take a look at our system now, where there are a bunch of strange incentives that I think waste a lot of money. We spend a lot of money on healthcare in America that doesn't really go to treating people.
Right.
We have 1 in 5 people go in a hospital, go home, they get readmitted because we don't do follow-up care. Just calling them on the phone and saying, hey, are you taking your medicine? Are you having any side effects? We don't even have those basic things happening in our system that could really cut costs. So if we want to really make our healthcare system better and have everyone in America have access to health insurance, we got to talk about how to make it more efficient and really control costs. That's what I'm trying to do. And there are a lot of different bills back in Congress right now. There's not just one. And this is a long process. There are a couple of ideas in the Senate, a couple of ideas in the House, but ultimately that's the goal we ought to be looking toward, is finding some way to stabilize this for the future.
Well, it sounds like the right way to reform it would be an even more complicated way, because you have to look at so many things.
It could be, and yet there's some models out there in the real world that exist that show us what to do, and one of them is right here in Utah. Now, our system, we have much lower costs and better quality than other states, because we have a system here that has embraced technology, that coordinates with follow-up care. The Intermountain program, quite frankly, the president keeps referring to Intermountain Health Care here in Utah. So there are real-world examples, not just theoretical ideas about how we can do better in our healthcare system. We just got to take what we're doing in Utah and try to apply it elsewhere.